the most significant identification feature is that most times they have the shape of a cauliflower. Genital warts are soft growths that appear on the genitals. As the name implies, genital warts, they are soft growths that appear on the genitals. Genital warts occur on the penis, they can be found on the scrotum, then they can also be found on the thighs, then they can be found in or outside the anus. While in females, genital warts can occur on the cervix, they can occur in or outside the vagina, then they can also occur in or outside the anus. Now, how can you get genital warts? Genital warts are sexually transmitted infection. You get them when you are exposed to an unprotected sex. You get the virus when you are exposed to an unprotected sex. That will now lead us to the cause of genital warts. What is the cause of genital wart? Genital wart is a viral infection that is caused by the virus human papilloma virus. Now, what are the risk factors for genital wart? Being sexually active, when you have multiple sex partners, and when you engage in unprotected sex frequently. Prevention of genital warts. How can you prevent genital warts? The first on our list is vaccination. Genital warts can be prevented by the vaccination using taking HPV vaccine, that is human papilloma virus vaccine. When it is taken, it can prevent genital warts. Apart from vaccination, abstaining from sex can also prevent genital warts. Having a single sexual partner or avoiding multiple sexual partner can also help you to prevent genital warts. The use of condoms. The use of condoms can also prevent genital warts. Lastly, let's talk about the treatment. How can genital warts be treated? Genital warts can be treated pharmacologically because I will be focusing on the medications that are used for the treatment of genital warts. The medications that are used for genital warts, there are three medications that you can use for the treatment of genital warts. The first on my list is the pudofalin pent 20% or the pudofalin creams 0.15%. For the pudofalin pent, which is very effective, use it with caution. Take the following concoction when you are using pudofalin pent 20%. The first caution you should take is you should insulate the surrounding with Vaseline. Don't just apply the paint directly to the wart. Make sure you first of all insulate the surrounding, even the wart, with Vaseline because the paint is corrosive as it can get your skin burnt. Then the second precaution is that it shouldn't be used every day. You can use it once in every 3 days. Don't use it every day. However, the creams, pudofilin creams are not as corrosive as the paint, so the creams can be applied. In the absence of the paint, the creams can be applied every day because they are not as corrosive as the paint. The second medication on my list is the antiviral medication, the acyclovir. It can reduce the viral load. Then the last medication is the immune booster. You want to boost the immune system of this patient because first of all, it should even be established that genital warts does not have a complete cure. So you want to boost the patient's immunity with the use of vitamin C, zinc, vitamin C 1000 milligram daily or twice daily, zinc 15 milligram daily. Also vitamin E to restore the skin health. Then you can also use cod liver oil. These are some of the treatment options for genital warts. Thank you so much for paying rapt attention to this video.